Hi, I'm joining you here today from our test booth to talk about what to expect from a hearing test. So many people are apprehensive to get their hearing checked because they just don't know what to expect, what it's like. So I'm going to walk you through that today. So I'm sitting here in my soundproof room. So this is a room where you will not hear any external noise from outside the door. We want to make sure that the hearing test is very accurate. So we get this room calibrated annually to make sure it meets those expectations. So first, your audiologist would bring you in this room, and first they would check your ears for wax primarily. They'll look in your ears with what's called an otoscope. It's just a light to look in there. I'm sure you've seen it at a doctor's office. They'll check for wax, any abnormalities, to make sure ears are clear before we do the testing. Next, you will either wear a set of headphones on your ears or some insert earbuds. So either one of those will be put on your ears, and you'll be instructed to respond either by saying yes or raising your hand when you hear some tones. So what we're testing for in that first test is how soft you can hear any tones at different frequency levels. Next, you'll be asked to repeat words. So we test a few different tests for words. First is a threshold. So we want to see how low you can hear and understand words to make sure it's matching up with the rest of our test results. Next, you'll be asked to repeat words at a comfortable but louder level to see what your clarity is like in quiet. Next, you'll be asked to repeat words in noise. So we like to see what your word understanding is when it's noisy. Some people do fine when it's quiet. In a restaurant or noisy group situation, it's a different story. So we want more information there. Lastly, you will wear what I call a headband. So this will go behind your ear, and this tests for what kind of hearing loss you have. So it actually sends the signal to your inner ear through vibration through the bone, the mastoid bone behind your ear. So that can tell us what type of hearing loss you have, whether it's conductive, where there's a problem with the middle ear, like an ear infection or fluid, or if it's sensory neural, which is a problem with the inner ear or nerve. So those are the basics of a hearing test. We also offer other diagnostic tests outside of the comprehensive exam, and we add those on as needed if there's further testing needed. The test takes about 20 to 30 minutes from start to finish. That includes taking a case history and explaining the results. So a question I get often is, will I get the results today? And yes, instantly when we're done with the exam, we have a screen in the booth here that we can show you visually what your test is like and really explain it in detail. And if you ever need a copy to take home, that's no additional charge. So we always provide you with your medical records if you request them. Sometimes we're also asked to send to a referring physician. But that's the basics of a hearing test. We do recommend an annual exam, especially if there is a hearing loss found. So if you're unsure of a hearing test and nervous, not sure what to expect, now you know how it works. So thanks for watching.